Hello, Christina De Avila,
Hi, Dahlia.
my CCNM friend,
Oh
another
my
fellow
goodness.
ND and diabetes educator as well. Yeah.
Yes.
Tell us, so why diabetes? Maybe we'll start there.
hmm Good question. So, I mean, for me, it's definitely there's a personal connection there. So, I personally have a strong family history of diabetes and cardiovascular disease. Um, And I think for me, the biggest turning point was actually when I was trying to decide what my future was going to be. Like, where am I going? What am I doing? What is my purpose? My grandmother was like at the sort of final stages of her life, right? And I saw, diabetes at its worst, right? So dialysis treatments. She almost had to amputate a foot because of a wound that wouldn't heal. She went blind. Her cardiac function was quite low, and so I remember just sitting with her in the hospital, and I was like, "What is this? Like, how on earth did my grandmother end up in this place?" Right? Where like she didn't have a quality of life. Like, let's be real, right? She was going 3 times a week to the hospital where they were weighing her because obviously her body was retaining a lot of fluid because she wasn't urinating. And you just start to question, like, what were the effects? Like, what were all of the things that happened where she ended up here?
Mhm.
And I think for me, it was like, I don't want this for myself. I don't want this for the rest of my family. And I don't want this for everyone else out there who may be, going through the fact that, they've recently been diagnosed with diabetes and, how they can really take things into their own hands. Because the reality is, when we look at diabetes, and obviously we're talking more about type 2 diabetes, although to some extent we are all also looking at type 1, there's still such a huge lifestyle component, right? And this is a condition or disease, whatever you want to call it, that requires you to manage it on a day-to-day basis, right? Like, this is beyond your 15-minute consultation with your doctor who's, checking your fasting glucose, your A1C, whether your medication is doing the job. This is the fact that once you leave there, everything you do, the way you eat, the way you move, the way you sleep, how stress is impacting, all of this is going to impact, that 3-month blood work,
Right.
right? And so it's really about the individual and taking on that responsibility, that knowledge, feeling confident of being able to manage their condition based on, their blood sugar readings or whatever it is that they're using to sort of guide them. So
Mhm.
that's, for me, where diabetes sort of lands and why I'm so, adamant about realizing that we got to take out the emphasis from the healthcare system. It's there for when we need it. And obviously it's important in certain circumstances, but this is really a part where we need to look at the individual. We need to look at health promotion in general, and how we can set ourselves up for success when it comes to the management of chronic conditions.
Yeah, because it's like with diabetes, it's not like all of a sudden one day you're diabetic. It can occur that way for
Yeah.
people who are sort of not necessarily aware of all the components. Like they go to their like this is what happened with my grandmother. She went to her doctor after got a routine blood work, and her doctor said you have diabetes. And but I know if we had analyzed her blood work probably 10 years up until that point, we would have seen signs of it, right? And
Yeah.
the more in-depth blood work you do, you can even see signs of like insulin resistance or symptoms of it. So it occurred to her she got this diagnosis and she was sad for a few days and then she was put on medication which so starting with metformin, obviously there's a limit to how much metformin can bring down your blood sugar before you
Yeah.
max out your dose. So she's added another one, didn't really work, so another one. Now we have these new drugs like GLP-1 and SGLT2 whatever.
Yeah.
And so she got on sort of this cocktail and she's like, okay, I'm good. And, you know, yeah, it's very disempowering, right? She sort of just put it in her doctor's hands. And who knows what her actual, I'm not involved really with her care, as you know, with family members. It's hard to be their
Yeah.
doc. Like, it's not a good idea. But I'm sure that if I looked at her HbA1c or her fasting glucose, it wouldn't be anywhere near optimal. she
Mhm.
might be kept in target, or it might be not as bad, but a lot of what you're told is like, okay, I guess it's good, or it's normal, or and then you're sort of just left to simmer, for the condition to kind of simmer until it gets to the stage of now your kidneys are not functioning, or now the blood vessels to your
Yeah.
eyes are like full of glycation end products and now you can't see, etc. So it's like this slow burning condition, but we're not really told what's happening. And it seems like there's just like a hard end point, like, okay, now there's diabetes, and you're like, well, what happened? Oh my gosh, just bad luck, or okay, now you have
Right.
kidney failure. And that's sort of how it may work if you get into like a car accident, if you break a leg or something. Like, okay, there's this moment when you were healthy, and then the next second you had something that needed to be fixed. It's not the case with diabetes. It's like a slow, it's like could have started manifesting like 25 years before you actually got the diagnosis. And yeah.
Yeah. Yeah. And I think there's a lot of myths out there that still to this day persist. Um, and it's kind of interesting to hear that. And so just to kind of put this into context, so in my undergraduate days, I was working as a pharmacy assistant. So I was there, dispensing people's medications, and there was like people who were at least on 3 4 different types of medications to manage their blood sugar, which to me means things aren't going well, like their body is not handling things, and like just more sort of medications being recommended. But then when you actually speak to them, it's the, I'm getting old. And I'm
Right.
like, oh, okay. So is that what we understand to be like? This is just the process of getting old.
And sorry to
Or the other
interrupt,
thing is,
but
yeah,
I just wanted to say in the 1900s, I think the year 1900, 0.37% of the population, so a third of a percent of people had type 2 diabetes. That was 120 years ago. Now it's 10% have diabetes and 30%, a third, have prediabetes. So this is not because you got old, because in 1900s people were old and they didn't have diabetes. In
yeah.
fact, they just like discovered, I think the first case of heart attack was in 1912. So this is a new modern phenomena. So sorry, okay, you can
No,
continue.
no,
Yeah.
absolutely. And then, you can pile on like our sedentary lifestyle or changes in food, right? Like the whole
Mhm.
shebang for sure. But then you also hear things like, I don't eat sugar, right?
Right.
And
Oh,
then, you go, okay, but do you eat bread, pasta, rice? And they're
yeah.
like, yeah. And then they don't see the connection, right? Because no one has broken down, what a carbohydrate is. How does it break down in the body? How does the body utilize it as fuel? What happens when you aren't burning that fuel, right?
Yeah.
So there's a disconnect, right? And more often than not, what I see is that, even though the guidelines say that first line therapy is nutrition and lifestyle modifications, this is often not part of the conversation.
Mhm.
And so people feel that, this is just it, right? I have to take this medication. It's going to help my blood sugar and there's nothing more. And yet we know when, we were trying to discover, when doctors were first trying to figure out how could people manage their diabetes, right? When they were, still in the process of discovering insulin, what were they doing? They were modifying people's diets, right? Like, oh, well, if we take out bread, potatoes, all of a sudden their urine isn't sweet, right? So nutrition has always been the foundational piece that we have looked at in terms of like modifying and how that affects certain processes in the body, right? So I feel like, it's such a part of our history, but yet we've lost it along the way. And
Mhm.
often, it's not, we don't talk about it.
Yeah.
So it is, it's troubling. And, that's, I mean, as naturopaths, and I'm sure you can relate to this, it is about breaking down these myths. It is about education, and it's about like helping people understand the
Mhm.
decisions that they make, especially around food, how it can either negatively impact or positively impact their blood sugar regulation.
Yeah, that's really a good point. There is this sense of, so, we've been educated, and especially in older generations, to sort of give up power and responsibility because health is really complicated to the professionals. And not knocking those professionals, because it's a co-creation, right? Like, there, I'm sure. So first of all, a medical doctor is working on a tight time frame. It's not so much about just maybe they do hand people handouts on what to eat, right? And it's like
Sure.
moderate dietary changes, nothing kind of revolutionary, nothing super strategic or pointed or helpful, in the sense of like looking at someone's diet and saying, okay, let's start here. Let's add some protein to your morning, that will help lower the glycemic index of what you're educating someone on, like, what is a carbohydrate? Yeah, like a lot of patients be like, I don't eat sugar, like I don't put it in my coffee, because we're not taught how to look at food. So we sometimes just assume that sugar is the white stuff that you actively put into what you eat, and we are not aware that it is in literally everything in a package, and et cetera, right? So just being aware, and we can think on a very binary scale of like following a diet, right, and then feeling shame because that's impossible, and then just whatever, like my grandmother was put, so she was diagnosed, she got put on medications, and then it was like this very sort of haphazard, like, here's a seminar. It was sort of like what we do as NDs as part of a marketing strategy, to have a little webinar or like a little talk, right? Like, this is not medicine. You're not giving any sort of real advice. Our license literally doesn't allow us to give you
Yeah.
like focused advice in a webinar. And so I guess she sort of attended one of these things with a dietitian. And so the dietitian is like giving very general advice that isn't really examining our own patterns and behaviors. It was things like everything in moderation and don't worry too much. And I was like, but the problem is that the people listening are already not worrying too much. And it doesn't mean that they have a bad diet, but something in that diet possibly needs to shift, or there maybe needs to be more understanding about the components of their food, or how they're arranging their food, or how they're eating, their stress levels. Maybe it's not even their diet, but there's something they're not working. So you can provide general ideas and principles in Canada's food guide, but
Hmm.
it's way more helpful to understand how you might start shifting your own behaviors in a
Yeah.
helpful and meaningful way, right? Like, because I think she asked about gluten, and that's not necessarily the right question to ask, because gluten doesn't necessarily have anything to do with it. If anything, if you're going from like gluten Oreos to gluten-free Oreos, that's worse for your diabetes because there's less protein in it. But
Yeah.
it's like, so it's the wrong question. So a dietitian's going to hear that question and be like, no, everything in moderation. And then my grandma will say, like, okay, cool. Whereas
Yeah.
maybe in her mind, what gluten free means is like how she sees me eat, where I'm like not eating like cake or
Yeah.
something. I don't know. So, so it's like there's a disconnect because it's too general. And yeah.
Right. And almost I feel there is this sort of tendency to what is the right diet?
Yeah.
What just, is it the keto? Is it low carb? Is it this? Is it that?
Mm-hmm.
And frankly, I don't think there is one right answer.
No.
I mean, there really never is, right? And
Yeah.
I think for me, one of the things that I like to talk about is like, what are the guiding principles we're looking at here based on what we know on how different foods affect, and obviously here we're talking about blood sugar, right? Insulin, blood sugar, all that. And the other thing is like, the reality is your body is going to tell us exactly what is happening, right? So if someone comes into my office and says, after my meals, I could pass out. Like, I just need to take a nap. That's a sign that there's something that is probably not okay, in the sense that there is a indication for change or a modification, right? So maybe that means that you're having too many carbs, your insulin is spiking through the roof, and your body's just like, we need to hold the phone and relax for a little bit, right?
Hold the phone.
Which shouldn't be the case. Hold the phone, right?
Yeah. Well, you
Which
should get
shouldn't be the
energy after
case,
you
right?
eat, right? That's the point of eating. Yeah.
Exactly, right? So now when we start to say, okay, well, we know that food is fuel, we know it's supposed to help us get through our day, and all of a sudden you eat and you're feeling like you need to nap, then what is the look of that meal, right? What are the modifications we can make? Sometimes it's even building things up before taking things out,
Yeah.
right? So like, what can we add to the plate? Maybe it's some extra fiber, right? Or whatever it may be, right? The other thing is, on the flip side, is people who can't manage skipping meal, right? Like I fall
Yeah.
apart if I don't eat, like I get a headache, I can't focus. Well, that means that, you probably haven't had enough protein and fat in that meal that you just consumed, right? And it's not enough to get you to your next meal. So these are the information, these are the pieces of the puzzle that can be so informative in terms of the modifications that this person sitting in front of me needs,
Mm.
right? So then you start to take away like, what are the keto and all that stuff.
Yeah.
Based now, I'm looking at you, you've told me what's going on. How can we look at the meals that you're having that are causing these certain patterns, and how do we start to modify them? If they're monitoring their blood sugar, even better, right? Now we've got like a true snapshot of what's happening internally, right? And if 2 hours after they've eaten, they're still, really elevated, then again, like that meal was probably too much for your body. How can we modify it? Whether it's quantity, whether it's, substitutions, whatever it may be, right? But these are the pieces that your own body is providing us that makes, personalized medicine really come to the forefront.
Yeah, because it's like where you're at right now, right? Like we don't know. I mean, maybe, well, even for general health maintenance, like nothing, you got nothing going on, you're perfectly healthy. What's the best diet for you? It's like, well, you can look at hunter-gatherer societies before all the chronic diseases, like back
Yeah.
in the 1700s or 10,000 years ago. And you can find like all, well, vegetarian communities, almost all meat-based communities. There's all these like huge differences
Yeah.
on the surface, but and that's the thing, it's like sometimes our focal point is the wrong reference. Like a patient will come in, I'm sure you've had this, where they're like, oh, I switched from this kind of cereal to that kind of cereal, and it's like, well, that's good, but probably, yeah, maybe we need to actually add some fiber, some protein, some fat, reframe what you consider to be a good breakfast and explain to you what's happening, why you are like scarfing down, sweets after dinner, and how that
Mhm.
actually relates to you not having had a good lunch or breakfast.
Right.
Why you feel anxious, why you feel nauseous, why you get headaches in the earlier part of the day, or even why you have an afternoon crash. It's like sort of helping somebody connect those dots versus like, because I think we can like zoom in and be like, what's a good food, what's a bad food? Like one patient's like, are bananas good? Or I thought bananas weren't good.
Hmm.
And it's like, but there's no such thing as a good or bad food, Even Doritos have a place, you know?
Yeah. Yeah.
But like a banana is not, although this is hilarious because my dad had a hernia and he was scheduled for hernia surgery, and they told him he needs to lose 10 pounds. So
Hmm.
classic, like what happens to like a man, not to sound like gender binary, whatever. But he was like, he was given a list of foods he could cut out to reduce his calories by 100 a day, and on the list was bananas. So he just stopped eating
Mm.
bananas, and in 2 weeks lost 10 pounds. And it's like, okay, maybe the pastries would have been even more effective. But I think it's like we see food like that, right? And that's so interesting because that's from the sort of the establishment is like, oh, you want to lose 10 pounds, cut out this series of foods, cake, bananas. You're like, not exactly the same thing. And it's
Yeah.
not about banana, like I don't know, he's probably the only person on earth that can cut out bananas and like experience some sort of meaningful health change in his life, right? But
Right.
ultimately it's not about one food in particular, unless that's the only food you eat. So it's the overall pattern, like zooming out and like, you know, what does vegan actually mean? It means you don't eat
Hmm.
animal products. But does it mean that someone who goes vegan is automatically going to be eating better? Not necessarily, you
Right.
know. It
Yeah.
like, so I think it's sort of, yeah, exactly. It's like more of like zooming in and then helping someone zoom out and really giving them context, like you said, is more helpful, versus like,
Hmm.
here's a food guide. The food guide is so general. Yeah.
Yeah. And I mean, and here's the thing as well, like, I think there are people who understand food and protein, fat, carbs, and they can understand those
Mhm.
sort of breakdowns. But the other thing that we have to talk about when it does come to nutrition is it's not always about food, right? Like,
Mhm.
food is very social, food is very emotional, right?
Mhm.
The pandemic has highlighted when food is really easily accessible throughout the day. You're probably walking towards the fridge and, just opening it up. Not that the contents have changed since the last time you've opened it, but you're just going to do it because it's there, right? So,
Mhm.
even our environment of itself, like, and obviously I'm talking a little more about like our home environment, can dictate what you're reaching out when you're going for a snack, right?
Yeah.
But also understanding, like, stress has been quite high, for example, during the pandemic. So now you've paired stress being really high with easy access to your fridge and anything that you have in the home. And often we can pair these two as, I'm just going to have something, and it's, it could be a coping strategy, right? It's,
Yeah.
food is calming, it's soothing, right? Especially, I'm sure we've all, felt sad and gone and got the tub of ice cream and just felt a little happier,
Yeah.
right?
Exactly.
um so even understanding those relationships, right? Because you can't change what you don't know, right? So if you start to catch yourself like walking to this fridge or the pantry, for the fifth time that day, even asking yourself, right? Like, hold on a second, what's going on? What am I feeling, right? Am I bored, right? Like, maybe it's not even anything else, but maybe I'm bored, right? And then there's the opportunity of like, what else can I do? Maybe I go for a walk. Maybe I call a friend. Maybe I grab the book that I'm reading, right? So then we can start to change those patterns into more,
Mhm.
helpful strategies, right? That aren't going to derail you or cause you to misalign with, anything that you're working towards, right? Um, so those are patterns as well to look at when we are talking about nutrition, and that relationship there with food and what it may mean for different people at different points in time, right?
Totally. Like
Um,
also like on the flip side of that is like the micromanaging where people are tracking every single molecule of food, and that may actually cause more stress and shift the whole
mhm,
picture into a direction that you're trying to move away from. And so it's, yeah, like taking like an accountability piece. Like I think a lot of us are afraid to develop awareness because of that. We might find that we don't like our behaviors, but awareness is the first stage to start to examine it. Like, okay, yeah, I've had ice cream every night this week. And can I just sit with that, first of all, without necessarily changing it right away, and just be curious about why I might have I might be having it. Like, is it a physiological craving because I undernourish in the day? Am I stressed? Am I bored? Am I anxious? Is there something? Is it actually like medicine for me right now? Because certain carbs and sugar can actually decrease stress hormone, at least temporarily. And
mhm.
if we are aware, we can decide where that behavior may fit into our overall health vision for ourselves. It doesn't it's not like I'm a bad person because I had ice cream tonight. It's like looking at it as like, how does this all fit? And yeah, I think that's a really good point. And is it something that I need? It's, I guess, kind of like if you're treating yourself like a 4-year old. Like I always talk about this. It's like if your 4-year old
Mm,
wants ice cream after dinner, you're gonna look at it. You're not gonna judge it necessarily, right? Like judge that phenomenon.
mhm,
You're not gonna judge necessarily the 4-year old, but you're gonna have some sort of like context for it, maybe a curiosity around it, or maybe it's like, okay, yeah, you had a healthy dinner, so yeah, you can enjoy some ice cream. You may also be curious if the 4-year old's like scarfing it down and asking for more, or mindlessly kind of eating the whole container,
mhm.
and you, oh, maybe you didn't eat enough today. Oh, like maybe we need to add a snack in at like 4, some almonds or something, so there's a bit of like it's lighter energy.
Yeah. Yeah. I love the idea of curiosity,
Hmm.
because I think when you're, rather than looking for a specific outcome, and you're just curious, like, what if I change this? Like, what would happen? You know,
Yeah.
it almost brings like you want to like see how your body responds, right? Like, sometimes I tell people like just increase protein in the morning. Like that's
Yeah.
it.
Yeah.
Like let's just
Exactly.
add some protein and see what happens,
Yeah.
right?
Just trust me and do it.
And
Yeah.
and then all of a sudden they come back and they're like, "Oh my God, like I wasn't hungry till like 1 or 2, where before I would be starving by 10:30."
Mhm.
Or like my energy was a lot better. And it's just, that subtlety of like, let's try this out
Mhm.
versus this is what we're going to do because this is exactly what's going to happen. Because we don't know that, right? Everyone responds to things differently. And then all of a sudden, people are more curious to play with the different elements, right? And also, I think for another thing that I feel can be really a sort of deal breaker for people and kind of turns them off from taking any action forward is the idea like this is it for the rest of my life.
Yeah.
Like I can never have, I don't know, gluten, or I can never have dairy.
Mhm.
Versus when you're like, let's try this for 30 days, like
Mhm.
just 30 days. And then
Mhm.
they're like, yeah, why not? Right.
Mhm.
So you kind of break it down in a way that feels so manageable. And then if they in fact see for themselves, like I felt the most amazing in these 30 days, they almost make the decision themselves of like, I don't want to go back because this feels so good, right?
Exactly.
So
Yeah.
now they've experienced it, and you don't need to, as a practitioner, convince them like this has to be it, and because now they've just experienced it themselves, right?
Yeah.
And that's really empowering and beautiful to kind of watch that transformation happen.
Yeah, exactly. That's like it's about freedom, not
Mhm.
restriction. And that I realize that that sounds weird. Like I have a food sensitivity course, right? For people to just kind of like walk them through the whole thing cuz it takes a long time to kind of tell someone. So here's a resource so you can kind of have it, and go back to it and get clarity. And that's what I end off with. It's like now what? And it's like, well, you can decide because I mean, ultimately if, you know, gluten gives me a migraine every time I have it, now I have freedom from migraines if I don't eat gluten, let's say, you know?
Yeah.
And it doesn't mean I have, like, no one is saying to me, I have an obligation to never
Yeah.
have a migraine. Like, if I love cake so much that I'm willing to have it, like, it's not moral, like, nobody's there. If I feel like bad about that because I'm like, well, I'm kind of causing inflammation in my body. Maybe it's not a good thing to be out of commission for a couple days because I wanted cake. That's totally up to me. And I think it's hard to kind of frame it like that because it may sound, we're
Mhm.
so used to guilt and shame and like, either I don't have the responsibility, like my doctor is responsible, or I am like feeling guilty all the time about and
Yeah.
we might feel guilt because we're not empowered. So it's really just like it's freedom. It's like, oh, you were getting these migraines once a week. Now you know that it's really connected to gluten, and now you are able to take. Now it's no longer a mystery, right? So now you can decide how you
Mhm.
want to go forward, and that's, I guess, like sort of this idea of intuitive eating. It's like you you sometimes need some background knowledge to be able to be intuitive, or this ability to pay attention, like you mentioned. Like if you've never tried having protein in the morning, or no one's ever helped you connect what protein in the morning might result in, you might never know. You're like, oh, one morning I had eggs and one morning I had cereal, and I don't know, and I ended up like crashing and binging in the evening. But why would I connect those two things? Why would I connect my eggs with not binging and cereal?
Yeah.
But when someone's sort of guiding you, then you're like, oh, right. Every time I have eggs in the morning, I'm not binging as much at night, or I'm not as hungry. I'm not thinking about food, or I feel more energy. I feel better mood. Okay. Um,
Yeah.
and then you can let intuition guide you, right? So it's sort of a combination. Because you said this before we recorded, you were like listening to a podcast where the interviewer was like, if your intuition is leading you to like, I don't know, like binge on like a bunch of donuts or something, maybe it's not exactly your intuition, right?
Yeah, right. Like it's your intuition that is based on hormones that are, doing their own thing. And really like almost like you are a victim to your hormones,
Yeah,
right? Like,
we'll get
I
back to it.
I sort of tell people like for example, like if they have like a bad sleep one night, right? Like they've woke up many times for whatever reason, and so the next day they're feeling exhausted, right? What is the most typical thing that we see for anyone who's had a poor night's sleep, right? Caffeine, right? They're going to just jolt up that engine, right? Which is the adrenal glands and cortisol, adrenaline. And they're going to look for high energy foods, which tend to be sugar, right? Like sugar based, I don't know, Snicker bars and whatever it is, right?
Yeah.
But it makes sense, right? Because you're just trying to rev up your body to kind of get through the day. Is that intuitive based on the poor night's sleep that you had and the hormonal sort of influence that's occurring? Yes, it definitely is. Is it appropriate? No, because you wouldn't be in that state if you had an appropriate amount of sleep and you had, good signaling happening internally, right? So I think we always have to, look into context. And I know that there's, anyways, there's a lot of opinions when it comes to like intuitive eating or intermittent fasting. And, some people are like, oh, you're just telling people to like restrict the amount of calories. But the honesty, like the honest fact too, is, I look at, when I was in elementary school or, in my younger days, we would have dinner at like 6:37, right? So we weren't eating past 9 o'clock, and we definitely weren't eating before 8 in the morning, right?
Yeah.
So inherently, our lifestyle would factor in a lot of these things that now we've, termed, intermittent fasting, or we've termed, intuitive eating.
Yeah.
And so, I think it's just the fact that we as a society have pushed barriers to extremes, right? We want to work from the crack of dawn till like, 2 in the morning. We want to be able to sleep minimal amounts, wake up energized. And this is not the case, right? Like, I mean, we can push these limits for sure, but there's something that's going to give, right?
Yeah.
So I think those things are really important to think about. And yeah, like intuitive eating, I think, is really important in the sense of, I often talk about social constructs of like, it's 12 o'clock, so you have to eat. But if you're not hungry, like, do you really have to eat? Or it's just because you think it's time to eat, right? Like I should eat now because it's lunchtime, or I should have a snack because it's 3 o'clock. But really, for me, what intuitive means is like, am I hungry right now? Do I want something? If not, then carry on, right? So I think that's the point, right? Like if you wake up in the morning and you're not hungry, why are you going to scarf down breakfast, right? So those are the cues that we need to start to pay attention to, not, I feel like a donut right now, and so that's what my body's asking for, and that's what I'm going to have, because maybe that's not what your body's really trying to say, right?
Yeah, it's like, again, it's like zooming out. It's like, oh, I really am craving a lot of sugar because I didn't sleep last night. And that might be fine if it's an off day. Like you had a dog, like Coco Dog, who kept you up all night. And it's like, okay, well, today I slept 4 hours, so I'm going to need more, and I have a full day. So I'm going to have caffeine, maybe a bit more sugar. When it becomes a chronic pattern, it's worth looking at. And it's, and it's also, pure intuition would mean probably that I would just sleep in the day. I can't do that. So my intuition's leading me to kind of make ends meet in a way that's going to balance me with certain tools like sugar and coffee, which is okay maybe in the short term, but long term we need to think about like, okay, why are you not getting a full night's sleep, and how is that related to your cravings and your energy and your mood and your blood sugar, and etc. And that's the same thing with like, it's like, well, I'm not hungry in the morning, which might be fine if at 10, when you're naturally hungry, you're able to eat something nourishing, and looking at it in the bigger context of like, right, you're not hungry, but then do you start getting really anxious an hour later and didn't necessarily connect that it was your blood sugar, and let's try eating and just see what happens. And I think I'm wondering if you could talk about insulin, because so I want to also point out, like, type 2 diabetes isn't the only, like, this is the end stage of metabolic dysfunction, right? And I think, like, we know a third, so 1 out of every 3 people listening, so maybe you listening, because there's two of us here. And so the third has pre-diabetes, right? Like, so we, so it's really common, and that's pre-diabetes. And then before that is insulin resistance. So maybe you could talk about insulin, because this is like a mental health kind of mood hormone podcast. And like, I see blood sugar imbalance as a core fundamental imbalance that is causing a really highly contributing to a lot of mood issues and hormonal issues.
Yeah. Yeah. I mean, and, I think more and more now, the more you read and, look at the literature, it's actually interesting to even reframe it as like a spectrum, right? Like it's not just insulin resistance, but insulin resistance on the spectrum of fatty liver, right? No one thinks about insulin resistance and fatty liver, and yet that is part of the spectrum of insulin resistance. So you actually might present with fatty liver, and often I hear it's, oh yeah, I did an ultrasound, they found fatty liver, but there's nothing to be worried about. And I'm
my
like,
doctor said
no,
everyone has
that
it.
means
You're like, no.
yeah. And so, I'm all like, oh my God, they're showing insulin resistance, right?
Yeah. High
That's sort of my first thought there. The other thing is, when we are talking about blood sugar and hormones, PCOS is on the spectrum of insulin resistance. Yes, there may be different types, but it's definitely one that's quite common, right? So for anyone who doesn't know, so PCOS is polycystic ovarian syndrome, and it is associated with insulin resistance that causes irregular cycles, and then a predisposition for women to be more in that sort of androgen sort of state where they're having more acne, especially in the chest and back, abnormal hair growth, and symptoms of that nature, and elevated testosterone in the blood. The other thing too to think about is obviously pre-diabetes, diabetes for sure. But even, I find that often people are falling in that at-risk stage of A1C, and it's often just sort of put aside. But when you look at those people who are at risk and you start to put a lot of sort of the additional risk factors, like women over 40, those of certain ethnic backgrounds, if they have a family history, if their, waist circumference is greater than a certain amount. I often really emphasize waist circumference versus BMI, because there is a lot of literature that actually indicates that waist circumference is a better indicator of insulin resistance and lack of insulin sensitivity. And so we can track that through loss of inches, right? And so we know that people are getting more metabolically resilient when their waistlines are a little, within a certain range. So that's, a huge conversation that I have there. And then also, like, all in all, in terms of insulin resistance, is then looking at mitochondria. So there's a huge, there is like insulin resistance is an indicator of mitochondrial dysfunction. What is mitochondrial dysfunction? Mitochondria are the powerhouses of our cells, right? They are the ones who take in, whether it's fat or whatever it may be, to convert it into ATP, which is energy in the body, right? So what is happening at the mitochondrial level that is causing people to sway a certain way, right? Are there certain minerals or vitamins or, amino acids, whatever it may be, that they need, right? We're talking B vitamins, we're talking about magnesium, we're talking about L-carnitine. How do we help support these processes? And when you look at the fact that a lot of people are on proton pump inhibitors for their acid reflux, which depletes magnesium, which depletes B12. When you look at, women who are on the birth control pill, which depletes B6, folate, B12, magnesium, these
Statins,
deficiencies.
And even metformin for diabetes and B12.
B12, right? Which is ironic, right? Because then we think of the fact that people with diabetes are at increased risk for neuropathy, and B12 is really important for nerve health. And yet you've got medications depleting this essential nutrient there, right? Yeah. So, we often think of, we live in a society of abundant food, like nutritional deficiencies don't exist, but they do, right? And even if they don't, even if it's not a frank deficiency, right? We are talking about functional deficiencies, which is a whole different conversation, right? It's not normal, right? It's optimal, right? So what are the processes that we're seeing that are being impacted, whether it's, low energy, mood, resistant weight loss, that is causing people to basically exhibit that their body is needing a little extra support. And I think the mitochondria is one that I often see, and I'm, trying to get in certain things to help support those processes, as well as in the liver, right? So I don't know if I answered your question, but
Yeah, totally. Like these are all really good things to pay attention to, right? It's like, I mean,
yeah.
it's so funny. Like, so, medical school, when they talk, they're like, oh, you get an hour of nutrition. So we got that same hour. I got that same hour in undergrad, pre-med. No, you did life sci too.
Mm-hmm.
And then we got that same hour again, I think in first year at CCNM. And that lecture is literally, here are the nutrients the body needs, and this is what it looks like when you are completely deprived of it. So if you've
Mm-hmm.
never seen vitamin D, like your body has never seen it, you can get rickets. So literally, you are a baby that's raised in a dark room,
Yeah.
So this is what happens. Your bones get soft. But you can just put vitamin D into PubMed, and there's, I think it was like 20,000 studies. You can literally say like sore finger, vitamin D, and there'd probably be a study on it. So literally, like any condition, hair loss, vitamin
Yeah.
D,
Yeah.
diabetes, vitamin D. I'm sure there's a connection. I haven't actually researched that. So so these are functional deficiencies that are very real. Like there's this man called Bruce Ames that came up with something called triage theory, and so he's like, your body will prevent you from getting the acute, you're going to die, your bones are going to get soft and collapse disease if you have a small amount. It's like budgeting. Like I have enough to get through the month, but I don't have enough to thrive. Or maybe I have enough to rent this crappy apartment full of cockroaches, but it's pretty like awful to live here and it's keeping my
Yeah.
energy down versus like I really actually need this much per month to be able to function. And because of this chronic deficiency, I'm making do for 25 years, but I'm going to develop this disease in 25 years because my body has gone through a shortage that didn't manifest quickly. And I think that there are some studies on magnesium deficiency in rats leading to diabetes. So they didn't necessarily see a connection between feeding the rats a bunch of sugar, but when they deprived them of magnesium, they weren't able to process the sugar in the same way. And like magnesium deficiency is so common, and is
Yeah.
that the answer? And can you resolve it once you get to that point by taking magnesium? Maybe not, because we have to get ahead of nutrient deficiencies before the body reaches a certain point of breakdown and compensation and a vicious disease cycle, right? Like yeah, we'll talk more about insulin resistance, like what actually happens, but you're sort of caught in this cycle once you have insulin resistance, and sometimes you need to kind of really shift stuff to get out of it,
Mm-hmm.
because it's self-perpetuating.
Yeah. Well, and I love that you talked about magnesium because one, it's my favorite things to tell people to take. But,
Best, yeah.
we talk about, we're on the Good Mood podcast, right? We're
Yeah.
talking about mood. We're talking about blood sugar regulation. You see this as a core, right, element in terms of the conversations that you're having. And interesting enough, when you start to look, there is evidence that shows that low magnesium does impact insulin signaling and insulin sensitivity. We also know that low magnesium is associated with more of an anxiety type predisposition, right? So now you can see the dots starting to connect when you're like, okay, so low magnesium is associated with anxiety, and low magnesium also affects insulin sensitivity or insulin signaling. And then you start to see those connections, draw out, right? Like they're not completely different, one is on Mars and one's on Venus, right? Like
Yeah.
these things are interconnected. And I feel that, as naturopaths, that's where we really thrive in terms of connecting those dots. Whereas I feel like, we still live in a medical system that's very siloed, right? Oh, you have a mental health condition, you go see a psychiatrist. Oh, you have an endocrinology issue or hormone issue, you go see your endocrinologist, right? So, we're still breaking things down, and yet, your mind is not separate from your gut or so
Yeah.
we have to bridge these things together to have, significant impact in a person's ability to thrive and, live their lives in the best way possible.
Yeah, it's like your hormones didn't know that they were only endocrine, it's like part of the endocrine system. Like your hormones don't follow that rule or concept. Like your thyroid hormone is doing stuff in every cell of your body, you know? So
Yeah. And
yeah.
the lines are getting blurred,
Mm-hmm.
right? Like the more we research, the more that, the literature comes out, you know, 10 years ago, we weren't talking about gut health and mental health. And here we
Yeah.
are, right?
Yeah,
And so the
totally.
lines are getting completely blurred, which is great, right?
Mm-hmm.
Because then we can have cohesive conversations.
Yeah, and then we have more, this is the idea of like integration, right? It's like we
Mm-hmm.
need the specialists actually talking to each other a lot more, or you can just get like a gooey naturopath to kind of seep into the cracks and
Yeah.
tell you how it fits together, or have a bit of that vantage point, which is like, herbs, nutrients, like these things are all networks. Like I tell this to my patients, I'm like, they're like, oh, if I start taking B12, will I feel more energy? It's like, I don't
Mm-hmm.
know, because your body might not think. It's like if I give you $100 and I'll be like, I expect Christina to be rocking some nice new shoes. You might be like, yo, I have to buy groceries. And like, that's what you're going to see. You're going to see more kale in my fridge. So I don't know, your body
Yeah.
getting B12, it may be like, oh, thank you. I've been like waiting to finally be able to like replenish some myelin sheath on my nerves, and it
Yeah. Yeah.
manifests as like energy right away, that you can subjectively point to. And but this is the idea of like the network effect. It's that you provide something that the body needs, and then it uses it in a way that is beneficial. There's some sort of like goo or intelligence, like, these are all like kind of woo words, but there's some sort of thing that's deciding what to do with the B12, right?
Yeah.
That is something beyond what we could maybe point to. Like we call it like the V's. But yeah, when you break your bone and then you set it, what is the force that wants the bone to heal again? um
Mm-hmm.
I guess it's all philosophical, but maybe we could talk insulin resist, like what actually is insulin, what's insulin resistance. I don't think we really talked about that on this podcast, and it's like worth knowing. And I also want to hear you
Mm-hmm.
explain it so I can improve my explanation of it.
Yeah. So, and it's interesting because the definition I feel for me has changed a little bit. And I think there's like two schools of thought depending on, who you follow. But so first and foremost, so insulin is the main hormone that is responsible for blood sugar regulation. So we eat a meal, typically it's going to have some sort of carbohydrate, whether it's coming from vegetables, whether it's coming from, sort of bread, pasta, rice. And that's ultimately going to break down into glucose or sugar in the bloodstream.
Mhm.
This is going to signal the pancreas to release insulin so that it can kind of bring things back down to a level by sort of shuttling the sugar to where it needs to go, which is our cells, right? And then into the mitochondria and producing energy, right? So insulin is going to sort of be in charge there, and it's always ebbing and flowing throughout the day depending on the meals we're having. And if we're having a more carbohydrate dense meal, it's going to spike a lot higher. If we're not having that much, it's going to be a little lower. The issue becomes the sort of chronic ongoing exposure to blood sugars, or meals that are very carbohydrate dense without a lot of the supporting nutrients like protein, fats, and fiber. And so what happens is the cells almost sort of get suffocated, and maybe they have too much energy. So what happens is on the cell, it's almost like they have a lock, and insulin is the key, and insulin wants to open up the lock so that it can, open the door and the sugar comes into the cell. What happens when the cell is constantly bombarded by that same signal from insulin, it's almost going to kind of keep the lock and not allow insulin to open the door. It may even sort of remove some of those doors from the cell. Now, we see this as sort of maladaptive. Typically, we see like insulin resistance as things going wrong.
Mhm.
Dr. Jason Fung, who is the author of the Diabetes Code, he actually looks at it as this is your body's way of adapting to the fact that it cannot handle things. So this is the way of the body trying to protect itself versus sort of increasing toxicity within the cell, because the reality is that the more sugar we're pumping into our cells, yes, we're getting it out of the bloodstream, but the cells don't need that energy because it's got so much already. And so what that starts to trigger is a lot of inflammation, a lot of oxidative stress. And this is where the damage starts to occur, right? And that's the problem when we're looking at just fasting glucose and A1C, because we're just looking at, are we getting blood out of the bloodstream, right? Which is great. Yeah, we don't want it there, but we also don't want it in the cells where it's not needed as well, right? And so this is where something like looking at fasting insulin in the blood, which is often not done in sort of routine screening, is that when we pair fasting glucose with fasting insulin, we can calculate something called a HOMA-IR score, which is basically an indicator of insulin resistance. So now we know that your cells are not responding. Often, I see insulin well above 80 or 100. And for me, that's worrisome, because then when we start to look at, what is insulin? Insulin is a pro-inflammatory hormone, right? Insulin also promotes weight gain. So then it's going to make it a lot harder for people to lose weight, which is often, a lot of the indication where people come in with diabetes or they come in with PCOS, and it's like, just lose weight, just lose weight.
Yeah.
But it becomes really hard to lose weight when your insulin is through the roof, right?
Right.
So looking at that, so knowing that, and also the other thing is, we know that insulin is also pro-clotting, right? That's why a lot of people who are living with diabetes are at increased risk for cardiovascular events such as heart attacks or strokes or whatever it may be. So we have to, it's not just about insulin and blood sugar regulation, but how is it impacting all these other areas of health, just by sort of adapting. So whether you see it as a maladaptive response or whether you see it as, the body's trying to protect itself, the point is that your body's not responding, and because of that, all of those sort of downstream impacts are happening.
Yeah, this is good. That's a great explanation. That's good. And I just to paint the picture, like the image that was in my head is like, so your toilet's clogged, but you're like, no, it's not, it's fine, because the time I'm gonna actually worry about my toilet clogged is once there's like 4 inches of water on the floor of my house. Right? It's like, so your cells are congested, they can't take in any more sugar, and they're already working at max capacity, and that's not reflected in your blood sugar. It might show up as prediabetes, but maybe even not. And so you got to start looking at more indicators versus just waiting until there's like 3 feet of poop water on your floor, like a spillover effect, right? Like, I think, so we talk about hormonal resistance. It's like the hormones are supposed to be like messengers, like a telemarketer, coming to your door. And when they come too often, you're like, okay,
you don't want to answer the door.
You don't want to answer the door. Yeah, you're like, I have enough pamphlets. Like, I'm good.
Exactly.
And like, coming back and back and back. You're like, yo, dude, I don't have time to read your pamphlets. Like, you're here so often, so I'm just going to stop answering.
Yeah.
And I'll answer once you've knocked a million times, because now I'm so annoyed. So we have this elevated fasting insulin, because a lot of the time people will have like low sugar, like their blood glucose is in a normal range, but they're dealing with, they're having a hard time losing weight. They have these inflammatory conditions, their brain fog, they can't go 2 hours or more without eating. And so we look at their fasting insulin, and that's normal. And it's funny because their doctor will be like, all right, no, you're fasting insulin. First of all, you don't need to test it. Okay. Once you get the test, all right, it's normal. But I always see it in normal range. And once I do a HOMA-IR, you start to see that there's some it's a pretty sensitive test. You start to see like an impending insulin resistance. And so we always say like the fasting glucose is one thing, but it's like you see it at one level, but there's another force pressing on it, and that's the insulin. So we want to know like how much insulin is required to keep your glucose at that level.
Exactly. That's what I like. So when I, have that blood work in front of me, I'm saying like, yeah, okay, your fasting glucose is in range. Fantastic. But your body's working really hard to get it there. Right. Yeah. And that's a problem, right? Because, just like anything that you push the limits to, it's eventually going to break down. I think another issue to really think about as well is we talk about insulin resistance, and yet, you get on metformin, you get some sort of like insulin promoter like glyburide, who's going to, create your, like, push your pancreas to release more insulin. And so we're trying to push the insulin pathway. We're trying to push it. We're trying to push it. We're trying to push it. And yet the cells are like, we don't want to listen to you. And we're keeping our doors shut. I don't care how hard you scream. And then eventually people are put on insulin, right? And then, so now not only are we perpetuating the weight gain, the inflammatory response, which is going to further aggravate the insulin resistance. And then often too, they get started on a certain dose of insulin, and over time it creeps up, right? And they're like, oh, my insulin dose has to go up again. My insulin dose has to, but the reality is that we're not treating the issue, right? We're sort of trying to forcefully open those doors and say, just do what I'm trying to say, right? And the other myth too is that we assume that the pancreas is not producing enough insulin. Like, oh, you have diabetes because, the pancreas has been worked so hard and now it's kind of broken down and the cells aren't producing insulin. And that is not often the case.
Fatigue, like we talk about adrenal fatigue.
Exactly. And we can see this, again, not very commonly done, but if we actually run what's called C-peptide in the blood, what this shows is, so when our cells sort of make insulin, they have insulin pre-made, and then when it's time to get released, it cleaves off this sort of protein fragment that's called C-peptide, and it releases the active form of insulin. So C-peptide is an actual indicator of your own production of insulin, right? Which is not affected by sort of the synthetic insulin that we get in the pharmacy and inject with. So we can actually see how much insulin your pancreas is producing. Is it in fact fatigued, or has there actually been destruction of the beta cells that produce the insulin, right? And so then we can actually monitor. And there is, I was just looking at a study the other day where it was saying how, C-peptide can actually be very clinically valuable to determine sort of the course of treatment for people, whether they will actually, in fact, need insulin. It also is a predictor of like glucose variability, because it tells us whether the body's producing insulin or not, right? So, we push these pathways, but really I think we need to take a step back and realize that these are the pathways that maybe we don't need to push, right? And this is why, a little segue here, like physical activity is so important, right? We know physical activity activates non-insulin dependent pathways to utilize, this fuel, burn it and get it out of the body, which is exactly what we want to do, because our cells are suffocated when we are insulin resistant, right? So, this is why lifestyle is the primary guideline and why it's so important, right?
I want to go back to this, but I just want to say too, like, so injecting, when you're insulin resistant, this is always so maddening to me, but I do get it, because elevated blood sugar is not a good thing. Like, that's what's causing the issue with the blood vessels, which is going to actually end in the thing that like ends your life, right? Like the kidney failure or the blindness, like that kind of, like needing a foot amputation. So you do want blood sugar down. So this is like, bailing water out of a sinking ship kind of thing. Like, but it's actually worsening the problem. But we're in a very reactive medical model. And so from their point of view, they're like, well, we need to get this down.
Right.
And the only thing, and they're sort of like, well, the only thing we can do now is just to kind of inject you with more insulin. So this is not what you want necessarily, but it might, this is sort of where things are at. But so it's sort of like just sending more telemarketers to the door until your door gets like broken down, and you're like, this is not, no one's happy about this, but this is sort of what we got to do. So that sucks, but it's something that's done. And so like we, from our naturopathic perspective, are like, this is crazy, but ideally you don't want to get there. But when you have one objective, which is to get blood sugar down, it makes sense from that standpoint.
Absolutely. And sorry to cut you off there, but what I was going to say is you're right. It's not, here's the thing. Blood sugar is not an issue as long as it's controlled. And it is the, elevated chronic elevation of blood sugar that is going to cause the problems, right? So it's not diabetes in of itself, it's the complications of diabetes. And here's the thing, I don't want to paint a picture of like, none of us should go on insulin and stop taking your glyburide. That's not the case, because sometimes it's necessary to get you to a good point, but it should not be the only variable in the equation, right? Because then you're doing an injustice to yourself, you're doing an injustice to your health, and you are setting yourself up for, that sort of progression that I'm sure you've seen, I see in my office, where they start on metformin, and then it's, another glucose controlling medication, and then it's another one, until eventually they're on, insulin or an insulin like, and, there's all these things that are coming up, which is great. Like, we always want to see, new therapies coming in, and they always have different advantages and disadvantages to them. But if nutrition and lifestyle, sleep, if these things are not part of the conversation, we are missing the mark substantially.
Yeah, totally. And then I want to come back to the exercise thing, because that is, I have found, to be honest, that has made the difference. It's literally like a walk around the block after every meal. And that's like controlled people's blood sugar. It's incredible, because they could be like on some crazy keto intermittent fasting, and that's like kind of not working because it's causing more stress possibly, and that's like worsening their insulin resistance. Then we do the walk thing, not like a marathon, just like a little around the block, and their postprandial, like post meal glucose, is like back in normal range. So maybe
Yeah, I even like telling people to do like a little experiment. I'm like, listen, take your blood sugar, go for a walk, come back, right? Then they see the feedback, right? Like, it's always about feedback. How do we reinforce this thought, right? And so when people start to see like, oh my God, yeah, it went down by, 1 to 2 millimoles per liter, or whatever it may be, that's substantial, right?
Crazy.
And that may mean that, and also then you can also understand like, yeah, maybe I'm going to opt for a little carbohydrates this meal, but I'm going to make sure that I go for a walk, just to make sure that I'm giving my body the chance to utilize that fuel, right? So then they can understand how to play around with those different variables, right? Based on what they want to achieve. And like you said, it doesn't have to be much, right? Like a 15-minute walk after, dinner or whatever it may be. It's not only like a nice wind down process, so, great, but it also is not something that is over the top that can make a huge benefit. And I think that's another thing, right? It's small changes. It's those little things that we do that compound, right? Like, it's not about each one thing we do, but it's the synergistic effect. And I feel like as naturopaths, we always love to talk about synergy and, the sum being more than its parts, right? Because when you start to like pair good nutrition with that movement, with good sleep hygiene, good sleep in general, like getting those 8 hours, prioritizing that, all together, this is going to come and really support blood sugar management. It's going to support mood. It's going to support energy, the whole gamut of things. So yeah.
Yeah, exactly. Like, you get side benefits versus side effects, where everything feels better.
Yeah. I love that. Side benefits. Absolutely.
And you don't have to be that guy that's like lacing up his running shoes after a buffet. It's literally like, this is the thing, right? We feel like so all or nothing, or it's going to change my identity, but it's really just like basically just standing up and like, going for a little walk around the block, just moving your muscles a little bit. Well, they're like a sponge and soaking up the glucose, and you won't get that post-meal fatigue or grumpiness or sugar craving, or you'll feel better as long as you can kind of like get yourself to that place where you're doing it. But it doesn't have to be big. If you can be like, okay, I can do 2 minutes of walking or letting my dog pee.
Yeah. What I would say too is, I think all in all, we get lost in the nuances, right? So I think for people to really set themselves up for success is, what is your goal? What are you working towards, right? And you don't have to tackle each domain all at once, right? If you want to, great. If you feel that's manageable. If not, and I'm going to use the example of physical activity, right? Like, maybe the goal is, I want to get out for 15 minutes, after each meal, right? And do that. Great. That's your goal, right? We're not working on anything else. The goal is to get outside for 15 minutes after meals. Maybe we check your blood sugar just to see how that responds, and that's it, right? But the beauty of setting goals is that they're always evolving, right?
Yeah.
So your initial goal of 15 minutes after going or after eating is going to change. And the reason why I say this is because people start to feel great. Well, you know what? I really love my 15-minute walk. So what I want to do now, right? And all of a sudden they're like creatively on their own, like of their own volition, are now sort of pushing that limit. Like, what can I do next to support myself, right? Maybe now I actually want to be more physically fit. I want to, increase my muscle tone, right? Now all of a sudden we're introducing strength training, which is again like super important when we're talking about metabolically active tissue, when we're talking about, as an aging population, we know that there's a loss of lean muscle mass. So this is super important. So now we've got that benefit coming in, right? And so I find that's the beauty of, it's, and that's why it's a journey, right? There's no end point, because once we reach a goal, and this applies to every sort of domain of our life, like how many of us in a career, right? I'm in that entry position. Now I want to, get to manager. Now I want to get to director. We're always looking for that next opportunity for growth development. And the same applies for our health, right? Like maybe your first goal is just getting your A1C to less than 6. That's your goal, right? Now it's, oh, well, maybe I can push it to less than 5.5, right? Maybe it's your insulin, right? And so, and those may be, I should actually premise, like those are the outcomes we're looking for, right? But the goals are how you're going to get there. Like, what are you going to focus on every day that is going to get you there, right?
1%
And
changes every day equals 37% in a
exactly,
year.
atomic habits, right?
Yeah.
So I think that's the beauty. And once you start to break it down that way, one, you're not going to get so lost or overwhelmed. And before you know it, you're, setting yourself up for, optimal health and blood sugar regulation, optimal health and mood. And it all comes down together, because the reality is the pathways all end up being the same, right? So it's just about making those connections.
This is so great. I know you have to go, so this seems like a really good place to stop.
Okay.
Drop the mic. Thank you so much for joining me. So I'm going to have links for people to find you on Instagram and on your website in the show notes if people want to book an appointment.
Beautiful.
And I know you're going to have some programming and some tips and stuff for people soon. We'll just
Right.
put that out there so that there's a accountability. And
Yes.
thank you so much for joining me.
Thank you. This was fun.